Welcome to the inaugural episode of Hofstra University's School of Health Sciences podcast entitled The Health Line, Issues That Shape Our Wellbeing. I am your host, Dr. Andrea Ault-Brutus, a special assistant professor in the Department of Population Health, and it's my honor to bring interesting and informative content about what shapes our health and well-being, along with innovative content that helps us gain a better understanding of our ever-evolving and complex healthcare system here in the U.S. I am joined by our Dean of the School of Health Sciences, Dean Reginald Alston, who is the mastermind behind our podcast. Dean Alston, welcome to Healthline.
Thank you.
So this is our very first episode of the Healthline. Why did you want to start this podcast?
I thought it was important as a School of Health Sciences at Hofstra University for us to share information, content that would be helpful and beneficial to residents of Long Island, and for that matter, the New York metro area, on the various widespread topics of health and wellness. And I also thought that as a School of Health Sciences, we're doing some excellent things, and I'm always searching for ways to promote our excellence and to inform others about the work and the scholarship and the teaching that happens in our school at Hofstra, so that they might be willing to join us in some of our activities. And if you are a student looking for a university, you can't beat Hofstra. And second, if you are considering a major, I would say that health sciences is one that you should seriously review.
I definitely agree with you. And we definitely want to dive into some of the new programs that we're going to be launching at the School of Health Sciences. Thinking about healthcare in the United States, what are some topics that you think will be interesting to discuss on the podcast that we should feature? What do you think is current that is exciting for people to know about in the field of health?
There are so many. Yeah. One would be health disparities, inequities in healthcare access and outcomes in areas such as maternal mortality and infant mortality, particularly within minority communities, is a area that nationally is being addressed by health systems and university faculty, such as the one in the School of Health Sciences, to try and figure out why a phenomenon such as infant mortality and maternal mortality in minority communities is happening, and what we can do to greatly reduce it and hopefully prevent it. In the area of healthy aging and wellness, people are living long. Longevity is higher. And so individuals want to know, if I'm going to be here longer, I want my years to be relatively healthy. And so what can I do in the way of diet, in the way of exercise? Another key area, I think, is artificial intelligence. AI is being used in every aspect of life now.
Very true.
The incorporation of robotics, particularly among the elderly with persons who have disabilities. How can AI and robotics assist them with activities of daily living? So those are just examples. There's so many more.
True. And I'm looking forward to us diving into those topics. AI, healthy aging, health equity, particularly the issue of maternal mortality and infant mortality. We have a great faculty member, chair of the Department of Population Health, Martine Hackett, who is doing amazing work in that area. So we definitely want to highlight the work of our faculty members and our students, and also our advisory board members. So one thing I want to mention, actually, that I think is very interesting, that we changed the school name. The name of the school used to be the School of Health Professions and Human Services. We recently changed the name to the School of Health Sciences. Why was the name change so important? What was your vision and goals for the school with this new name?
The previous name wasn't horrible. I just think that it didn't reflect fully who we are as a school. And so by adopting a new name, School of Health Sciences is far more encompassing of all of our professional degree areas in allied health. It's more progressive, I believe, to say that you're a School of Health Sciences. Science is important because we are about conducting research to expand knowledge, to contribute to the literature as it relates to areas of healthcare. And so, and the other name was difficult on a much simpler level, was very difficult for people to remember. SHS is easier.
Pretty easy, yes.
Rolls off the lips better. School of Health Sciences, the same. It has cachet. I didn't change the name in isolation of advice and guidance from my faculty, alumni, advisory board members, stakeholders. So it was a collective effort by many to settle on the School of Health Sciences. And I think it's a better name. It enabled us to grow under that title because, as I said, it's encompassing. It's pretty broad.
Yes. Well, I was one of the faculty members who agreed on that name, so really happy that we went with it.
Okay, excellent.
And you mentioned the research and the work that we're doing in the School of Health Sciences, which is amazing work. I can imagine that we have some new programming coming down the pike. What are some of the new programs that are going to be coming out of the School of Health Sciences?
Well, our newest degree program is the Doctorate of Physical Therapy, which we launched last July of 2024. We are extremely excited about that degree program. It has potential to be one of our most popular programs. Physical therapy is a workforce area that's in high demand nationally. And so we think because of that, we're able to attract a reasonable sized student enrollment, send those students out to work in settings in which physical therapists are needed, clinics, hospitals, community agencies. We've assembled an unbelievable faculty. Eventually, we're going to have as many as 10 faculty in that area.
Great.
Currently have 7 top-notch producers of scholarship, excellent track records as faculty.
Great.
I'm extremely excited about the program. Some other areas that we're looking at, perhaps a degree in nutrition science that we currently do not offer.
Okay.
But we believe there may be a market for graduates from that program. If you look at the Bureau of Labor Statistics and Occupational Handbook, nutrition science is one of the areas in healthcare that is predicted to grow 16% faster than, on the average, than other occupations in general. So that's just an example of a direction that we're considering.
Okay.
We have to do a feasibility study, a market analysis first to see if it will be a viable degree area for us, but we're hopeful. It's important as a school that, in my role as dean, that we don't become stagnant, that we are always looking for ways to advance, elevate. Student growth is one way to do that. The faculty and I are always exploring new degree directions that we can take.
And it's great to think about the future. Where can we take the school going forward? What's interesting to me is that when you go to the website for the School of Health Sciences, you immediately see this quote, "The future of health is here." What does the future of health mean to you?
As a dean, I want to make sure, and this is on behalf of the faculty as well, that we are producing graduates that know how to build and sustain healthy communities globally. I know that is a pretty large statement to make, and you, along with the listeners, are probably thinking, okay, how exactly will you do that? Through our teaching, we want to ensure that our students have the knowledge about wellness and healthy aging, as I stated earlier, that they are familiar with causes of leading diseases and chronic illness, and how, as a society, we might go about preventing or at least reducing those diseases, particularly from a public health perspective. We want them knowledgeable about disability inclusion and independence, because that's a population within the country that we advocate as health care professionals to make sure that they are seen, heard, and are participating fully in American society. As I noted earlier, we want them to be knowledgeable about how to reduce and at times prevent health disparities, or disparities in disease incidence and inequities in healthcare outcomes. We also want them knowledgeable about the use of health technology, health informatics, for the purpose of improving efficiency and quality within healthcare settings. We place a lot of emphasis on creating leaders within allied health because we want our students to be skillful in writing policies and enforcing policies that will improve overall health within society. In terms of a vision, as you stated, health is now.
Yeah, the future of health.
The future of
health is now.
If you think about TED Talk, its tagline is to spread ideas. Well, the tagline for the School of Health Sciences is optimizing health through the lifespan.
Nice. So with this being our inaugural episode, I could see the vision that you are laying out for the podcast to talk about the future of healthcare and preparing our students to be leaders and affect change in that future. As we move into the season of this new podcast, do you have any parting words that you want to share before we wrap up this first episode?
The aim here is to provide content and information that listeners will find useful as they navigate healthcare systems, as they make individual choices about their personal health, as they select insurance coverage, as their parents or grandparents, or at the point of selecting a Medicare carrier that can be overwhelming at times or a little scary. We want to be able to have experts and professionals on the podcast who can simplify that as much as possible for them. Of course, we want to have our faculty members who can come and share their scholarship about the range or continuum topics that they're studying. We want to have our advisory board members who are experts, top executives of health systems to talk about what they see as trends, be it in long-term care, be it in veterans care, health care, be it in women's health. The primary aim, as I said, is to have the listeners feel that they are more informed, more educated about health care in general. And we also want to, in a promotional way, brag about the School of Health Sciences because we're doing fantastic things. We would like others to know.
Yes, what we're doing here.
Yes.
And it's some amazing things. Well, I just want to thank you, Dean Alston, for thinking of this vehicle that we can use to bring this information to the public. As we know, health is a major topic of discussion in everyday life. So I'm really happy personally that we have this type of platform to spread knowledge, spread information, inform people, and empower people with information that can help just improve their lives and the lives of their loved ones. So I'm really thankful we have this platform and super excited to be the host and looking forward to bringing some great individuals like yourself here to talk about what can we do to improve health in society. So just want to say thank you for even thinking of this idea, and we're going to move forward with this.
Andrea, I want to thank you for agreeing to serve as our host of the podcast. I appreciate your invitation that I come and share my vision about the School of Health Sciences. I hope that this will not be my last visit.
I don't want it to be your last visit.
Okay. But thank you so much for having me.
Thank you. That's the end of today's episode, and we look forward to everyone joining us in our next episode of Healthline, Issues That Shape Our Wellbeing. My name is Dr. Andrea Ault, and I'll see you next time. Bye-bye.